Nominated Senator Judith Sijeny appears to be a woman under siege. The Lone Ranger who chose to bite the bullet by crafting legislation that she believes, if understood, will have a positive impact in addressing social challenges facing adolescent youth.
At this age, we know most of them who want to be sexually active use them. We have seen even the media has been very good in that. They have shown the way young girls pop the emergency pill. They just take it twice or thrice a week, and they don't know the dangers. They hear these things. Some children even steal from their parents without knowing, and they start taking. Some just buy because they're available over the counter. So you have to tell them the repercussions.
Many of us could have chosen to bury our head in the sand for religious, cultural, or ethical reasons, but numbers don't lie. Every year, non-governmental organizations and government departments churn out statistics of minors forced to drop out of school due to early pregnancies, forced marriages, irresponsible sexual behavior that exposes them to HIV/AIDS, and unsafe backstreet abortions. To put a face behind the statistics, just today, a 16-year-old class 7 pupil will have to put her education on hold in Murang'a County after her 64-year-old father reportedly impregnated her. He has since blamed the devil for his actions.
Siku ya tarehe 7 mwezi wa 4.
Such incidences are disturbing in addition to adolescents engaging in risky sexual behavior. It is this that has Sijeny convinced the government should abandon its abstinence campaign and bridge the lacuna in law on matters touching on reproductive rights for adolescents and mentally challenged individuals by allowing adolescents the right to sexual health education through legislation.
Study 8 dropouts. Every year we hear 200,000 and from 4 dropouts who do not reach any higher level. Studiers don't go to Form 1, Form 4 don't go to university or college institutions. When we have these friendly institutions, they'll be given alternative learning methods which will be run by the government. And this is when we were saying in the bill that they can refer depending on whatever they need. Because a child will not have any sexual problem, will not have any problem with his sexuality or body or growing up. What they have is idleness.
But in her crusade, she'll have to convince her fellow legislators and the men and women of the cloth that this law will not promote immoral behavior as has been alleged. The bill has generated controversy over an alleged clause that condoms and contraceptives will be distributed in school. Sijeny, however, terms these allegations as inaccurate.
There's been the talk that contraceptives and condoms are going to be distributed to these children. I had never, ever, ever thought of such a thing. In my bill, there is nowhere that I have said they should be distributed to children or wherever.
She has urged Kenyans to take time and go through the bill, which she says has other benefits that haven't been debated, citing the provision in law making it mandatory for all Kenyans to receive emergency medical treatment in whatever circumstances, including inability to pay, and the creation of a level 5 hospital in every county, fully equipped to handle childbirth emergencies and intensive care patients.
The church said, which we'd have no problem with because it's the law, you must start by saying termination of pregnancy on demand is not permitted under this provision, under the provision of this act. So that is the amendment that we are going to bring, which will, for clarity, stop anyone who may be reading this section upside down.
As the Senate awaits to begin debate on the bill, it will be a delicate balancing act in legislation on social realities affecting adolescent youth in the midst of religious and cultural realities. Sex remains a taboo topic for the conservative Kenyan society, and the introduction of the reproductive health care bill is bound to elicit mixed reactions and ignite debate on a topic that most parents avoid to have with their children. Marion Kanari for the Bill Tracker in Nairobi.